This clinic was put in place with the ideal that we would take care of patients that nobody wants to take care of.
This public Montreal Ophthalmology clinic is advocating for low-income patients, a community of refugees and asylum seekers that they say is often forgotten and overlooked by the provincial government's healthcare system. With long wait lists for public care, new arrivals with urgent health problems are often left on their own or forced to seek care in private clinics, whose services they say are often unaffordable. That's why this community clinic with a multicultural staff who are often new arrivals themselves has made it their mission to offer specialized care to those in need.
The waiting lists were for over 5,000 patients that needed to be resorbed within the public system. Those waiting lists had been ongoing for over 4 or 5 years and backed up because the public system can only take so much. So the ideal here was to open a clinic that would be able to deal with those waiting lists.
In the beginning, they would see patients that in some cases had been waiting since 2018 to see a specialist in Quebec's public healthcare system, often with urgent cases that were supposed to be seen within 10 or 30 days after their initial consultation.
We wanted to be that middle ground for the patient who may have an emergency sometimes and want to be able to consult someone, faster than a couple of weeks and not have to spend, 18 hours or sometimes even more at the emergency room in one of the hospitals.
Over time, after seeing a strong need within the community of refugees and asylum seekers that were often left on their own due to the language barrier, their mandate evolved to treat this underserved community.
In the case of this clinic, the care of refugees was not just a mandate that we took on for themselves. We are also staffed by people who are new arrivals in this country, who come from the Middle East, who come from Eastern Europe, from Ukraine. For us, it was important that these people, when they came here, when the refugees and asylum seekers came here, they could find people that spoke their language.
After tackling the 5,000 patients on wait lists for specialized care in Montreal's public sector, they're now ready to take on the long wait lists in the Montérégie and Laurentide regions around Montreal. They've even found a solution to accommodate patients that are coming from these regions.
And specifically for all my patients from Montérégie, Lanaudière, and Laurentide, we open on stat holidays so that the traffic is less, so they come and they make a day of it. They come to see us and then they go shopping and then they go exploring a little bit. So I think it's working out for both of us fantastically, for all parties involved.
Right now, their clinic has 3 to 4 ophthalmologists on staff, which enables them to see 25 to 30 patients a day, and where patients with a referral can be seen within a week.
We haven't really geared up fully. We're not yet operating with multiple ophthalmologists every single day of the week, but this is the plan.
In Montreal, Corinne Boyer, City News.